Live streaming has started.
Yeah.
Actually, just now some participants got back to me through WhatsApp saying they're unable to join still, but they're trying.
It has just started.
Yeah, just now it started.
Yeah, we can start.
So shall we begin?
Yeah.
Okay, good evening, everyone. Today we have with us Srimati Swati Bhagchandani, a clinical psychologist and founder of IDHA, who has an MPhil in clinical psychology and is currently working as a clinical psychologist at IDHA clinic. She's also the student counselor at Indian Institute of Management, Lucknow. Her areas of interest in the clinical sphere include working with children, young adults, dealing with anxiety, depression, borderline personality disorder, and emotional abuse as well. We are so privileged to have you here with us, madam. Welcome on to our program.
Thank you. Thank you for introducing me. Though I am not sure, but if Srimati will be applied onto me or not, because I'm unmarried. And the other thing is, it is 𝒂𝒐𝒏𝒅𝒊𝒏𝒈. The name of the clinic is 𝒂𝒐𝒏𝒅𝒊𝒏𝒈. It means insight. So the name was chosen because of that. And it's a Hindi word, basically.
Okay, ma'am.
Yes.
So thank you for this information, ma'am.
Yeah.
That's insightful.
And I'm very grateful and thankful to all of you for giving me this opportunity. And, it's a big platform and going live with you all. And it's going to, I'm hopeful that it'll be an interactive session and, we'll be learning from each other. And I'll get to know a lot of perspectives because I know that you've been having this event from past 2 days. So I'm sure you've got a lot of questions and, areas where people are wanting to understand mental health in different spheres of life. So you might be knowing it way more among student crowd. And so, yeah, let's proceed with the different questions that you have.
Okay, ma'am. So on to Yasin, who will be beginning the interview with some of our most asked questions.
Good evening, one and all. This is Mohammad Yasin from Council of Public Health in Simsa. Without any further ado, we'll start our interview. The first question today, ma'am, is that what are the issues that have most commonly cropped up in the mental health sphere since the pandemic began?
Okay. Hi, Yasin. So, during this two phases of lockdown that we've had over this period of, pandemic, global pandemic, the phases had different, kinds of disorders that came up or mental health issues that came up per se. Firstly, because it was very suddenly that the first lockdown happened. We weren't aware that, it is coming. And even if we were more in that denial that, it's not going to happen in our country. So, but then when it happened, it was a hard hit on our mental and emotional well-being. Because the transition wasn't chosen one. It was something we weren't prepared for. It just happened to us. So that brought in a lot of hit in terms of emotions. Plus, there was a lot of chaos that the public was dealing with, right? I mean, half of them couldn't travel back. They were scared what's coming. We were uncertain in totality that, till how far are we going to stay inside? So because there was uncertainty and uncontrollability involved, so a lot of anxiety issues came up then. And then people who were, suddenly locked up inside, who were not used to being inside. In fact, we all are not used to, we're not trained that way. We had our routines, we had our, college, institutes, a different environmental change. We were used to that ever since our childhood, we've been used to that. So that sudden change of being just inside one, area was bringing in a lot of discomfort and helplessness. A lot of hopelessness was coming in, low mood, and self-harm behavior was at a rise. So that was there. Then because suddenly everything had changed, so again, lack of boundaries were there. People did not know how much space to give, because when you think of a home environment, it's more like, that everybody is at home, and that's a point to relax, and that's a point to interact. And then when you had to work all day long, because even the companies weren't able to understand for how long or when to conduct the meetings, how to conduct the meetings, everything went online. So there was a lot of chaos going on. And with a lack of boundaries, a lot of abuse and disharmony came into families and brought in mental health issues. In the second phase of the pandemic, because there was a lot of grief taking place. There were losses. People were losing their loved ones more than what had happened in the first phase. So the cases were marked by grief, bereavement, and again, a lot of helplessness, hopelessness coming in. So that's what is there. And in fact, now that, we're going back into this breathing space of normalcy, with this awareness that, there might be another wave coming in. So people are already now thinking of that and feeling anxious. I've already started getting in cases for that now. So yeah, those were the different kinds of cases that came up.
Thank you, ma'am. Thank you for your insights. And God forbid another wave of the corona. And we'll get on to the next question. How does one evaluate when they need professional help, and how long does one need it?
Yeah, so this is the most commonly asked question. Actually, I think I have addressed this question in every talk that I've had with different institutes. So we talk in terms of 3 Ds, like when it is about our emotions, because positive and negative emotions both are to be taken normally. If there is a situation which calls for you to feel sad, you will feel sad. You can't say that this is depression. All right. So how to differentiate between what is, a general mood, a negative mood that you're dealing with, and when does it require attention, and, when does it require treatment, depends on certain criterias that we have. And the first one being the duration for which you've been feeling that mood for. So if you've been dealing with a low mood, for how long have you been dealing with that? Has it been a consistent state off and on? Even when you try different things, it's not changing. Or even if it is changing, it's for a small duration of time, and then it comes back. So that duration matters. Then the dysfunctionality that it brings in. What are the areas of your life that have got affected just because of this emotional and mental state of yours? So example, are you able to carry on with the work that you used to earlier? Are you able to carry on with your social relationships like you used to earlier? And are you able to take care of yourself? So self-care, social areas, and your work and responsibilities. All of these 3 areas are to be taken care of. And then the severity depends on how much are the areas affected. So if the self-care has got hampered entirely, it means that the severity is too high. And then last is distress, because you are the one suffering. So you will be stressed with that. Are you uncomfortable about the emotional state that you're dealing with from this prolonged period? Also, are others around you observing and feeling distressed because of the change in your emotional state and behavioral patterns that are there? So these are the 4-5 ways in which we decide, when one needs to be aware of that. Our basic tendency is to primarily deny the negative emotion, or just to, kind of shame ourselves only for those negative emotions, that how can I feel that way? Why am I so weak to feel this way? So we start shaming ourselves, leave apart what others do to us. So yeah, so these are certain points to be taken care of.
Thank you, and that was actually a much needed answer to know when to approach and when to get professional help and all. And if we want to get a professional help, like what are the different types of therapy available right now for people who want to approach professional help?
Yeah. So, this question has a very wide answer, because there's several types of therapies, and different people are practicing different types and schools and And when you read about psychology, you get to know a lot about, the classical ones, basically. Now, it doesn't really matter what therapy school is being used. What matters is who is the professional, what stage have you gone for that therapy at, and what is the need for the person. So to simplify it, I'll just explain it in terms of prevention, cure, and treatment wala line. So primary prevention is the first thing that you can talk about. Primary prevention is when a clinical disorder has not occurred. You are in a phase where you're dealing with concerns, maybe emotional, behavioral, or daily life stressors, where you go and take care of yourself. So basically, the way you take care of your health, that before falling ill, I should be taking precautions. So precautionary measures of taking care of your health, like the way you're doing it, right? Being aware, taking care of yourself, practicing certain rituals to take care of your emotions and your mental health. So that is primary prevention. Then comes in the secondary prevention, secondary level of treatment, which is when the clinical disorder has taken place, the illness has occurred. Now, when a person is in depression, or is suffering with anxiety, or any other disorder for that matter, depending on what the disorder is, what the severity level is, where does this disorder emerge from, like the duration, the factors, the social factors acting on it, all of it will help us to decide what approach we need to take for the therapy. Okay. And then the last is tertiary treatment, and that is that once the disorder has happened, now probably you've recovered from it, or you're in that maintenance of treatment, that now you only need follow-up sessions, or maybe you need a lifestyle to maintain yourself and not have a relapse, maybe. So those are the stages we need to take care of. Whether you need a clinical approach, or you need to just go and see a counselor. So these are two different areas. And till where schools of therapy are concerned, the most commonly practiced ones, or the known ones, include, of course, psychoanalysis, coming in from Freudian school of thought, then cognitive behavioral therapy coming from the cognitive school of thought, and behavioral school of thought in combination. And so this one is highly practiced, CBT. I'm also a CBT practitioner. I'm trained with that only. So we talk about cognitions, perceptions, emotions, behavioral patterns. And then you also need to know that if, pharmacotherapy is needed. So different things. You can't just choose that. I mostly use integrative approach though. So I use mindfulness, I use concepts from transaction analysis, and talking about each of these will be very difficult in such a short span of time. So, yeah.
Okay, thank you, ma'am. Next topic we would like you to address is about, could you shed more light on the queer affirmative therapy, and how does it benefit the queer community?
Yeah, so I heard the live session done by 𝒂𝒅𝒆𝒍𝒇. I think she covered up this topic very well. I mean, everything was almost covered in there on your Instagram handle, and it was a nice conversation that took place. So if you talk about queer affirmative therapy, you have to also know what is queer friendly atmosphere, and then come down to what queer affirmative therapy is. So when you talk about queer friendly atmosphere, it's more like I accept all genders and all areas of fluidity and sexuality, and I am comfortable about it. That is being friendly. Okay. The way you talk about being an ally to the community. When you talk about queer, affirmative therapy, it is more about how aware as a therapist am I about their issues from their perspective, not as per how I, as a heterosexual, or like as a cisgender person, understand their world, not that. So empathy, how we use the term empathy in general is that, if I am wearing somebody else's shoes, I may not still feel the pain in the person's foot, because the size of the feet is different still.
Yeah.
right? So
Yeah.
then I have to understand it from that person's perspective entirely and not put in my own idea of it. Then understand my limitations, because if I'm coming from a privileged background, I need to identify my own limitations with it. There might be, and then acknowledge it in front of the person. There's no harm in talking about your own limitations, and therefore open the ground for understanding what they're wanting to convey to you, or what difficulties they're wanting to discuss about. So that's more about being queer affirmative than being friendly, you know. That I know what you have as your issues, and I know, so no, I know, say you have to move towards, please tell me what are your concerns, more like that. So yeah.
Thank you for your great insight on the topic. Next question would be, this pandemic, as we have talked, has created chaos all over the world. And there was a problem of distances and the lack of intimacies, and these things have an effect on the relationships, be it the therapist-client relationship or be it the relationship between the friends or a couple. So, what do you think has this pandemic on effect of these relationships?
Yeah, so it's a wide question again. I will probably answer it in terms of how the distance or the lockdown or all of these pandemic situations really affected relationships in general, rather than picking up different dynamics in different relationships. Like you know, mostly people were finding it hard, like in the initial phase. Again, in the first phase, people were having a lot of trends to post about, try, so they were kind of trying to adjust with the newness probably, and they had concerns to discuss, like the news updates, or maybe just the trends. So they were more like, from an all-time working and struggling lifestyle and rushing lifestyle, they had gone into that phase where they were just giving themselves some time and trying out newer things, more of their interest. So even though there were cases of anxiety and fear and uncertainties, they were also trying to adapt a lot, right? So that gave them a chance to explore about their relationships a lot as well. However, in terms of family relationships, there were a lot of increased cases in terms of abuse, in terms of domestic violence, in terms of family boundaries and unhealthy dynamics. That was an increase. In terms of distance, you know, again, that you are not meeting the person. So the energy exchange is not there. The human energy exchange is our primary, need. It wasn't there. So suddenly there was this loneliness coming in, even if you had people to talk to. And then swings in mood coming in. So a lot of things were seen. And at the same point of time, there were people who were exploring, how this digital platforms were going, increasing their ways of letting people connect with each other, like dating apps going all global, or maybe like the screening being done in a shared way on
Yes.
like the networks, the Netflix and everything. So both the sides were there. And in terms of the second lockdown, again, it went hard. It went very hard for people, on people, because people did not know for our for our entire lives, we've not known how to handle death and grief. We've not known that. And suddenly it came as a flood onto us. Everybody was talking about it. The moment you open the social media, it was all over there. Anybody you give a call, you were listening this news. And most people did not know how to respond to that. So they were going numb. In that numbness, they were going into depression, and mostly it becomes difficult over a call to understand that, right? And every lack of communication was only increasing the uncertainty of the possibilities being at the other end. So that was how relationships got affected, mostly. Mostly, yeah. Anything else? I don't know if I covered it correctly or not, but then I'm assuming that
Yeah, in the broad sense, you have covered everyone thing. So regarding the next thing, let's say I have a person who is dealing with the mental health issues. So what are the ways, I could be a better friend or a partner or a person so that I could be with them and help them with their dealing their issues, and especially in the conditions where I could not be like physically being around them. So how could I be any of help them to them?
Okay. So for this, there are certain do's and don'ts actually. I mean, even when a person is suffering with a mental illness, I would like to assume that the person is also considerate towards the other partner at the same point of time. You can't be expecting the other partner to be your therapist first and foremost. Okay, so do's: be compassionate, be available, be an active listener to the person. Probably have a time fixed for your call and availability so that the other person who is wanting your attention knows for sure that this is the time we can talk about anything. That's a free space where I can, be expressive about my concerns. And it's also reassuring, and, the person is able to kind of feel that the invested trust is in place. So that is one way to go about it, because there were also a lot of complaints coming in where, there were random calls to talk about how a person was grieving or how a person was feeling anxious or panicked. Now, the person at the other end, who is a friend or who is maybe a partner, may not be in the same kind of a mode, maybe having an important meeting in within 5 minutes to that call, or maybe having, may have just settled down from their own emotional state. So it's very important to take care at that level also. So to be able to handle it better, have a time specified that, this is the time when we'll connect over these kind of issues and talk about it, and from both the ends. And if there are any let's say urgencies, emergencies, and there's a sudden panic attack and I need my friend there, so then have maybe a group of friends who can be available for it, or maybe have your emergency contact numbers, like the helpline numbers in place. The Indian Association for Clinical Psychologists, they came up with a helpline number. You can search for it. That helpline number, you can post it after, the video session, you can post it here. Because helpline numbers are made for these reasons. Like not everybody can be available for such emergencies and in the right space of mind also. So those are the do's. The don'ts are that do not take yourself or be available beyond your capacity, because then it will start hampering your own mental health, right? And when you're not able to be honest about it, that I can listen to you, however, I may not be able to help you entirely. So what do we do about that? Ask the person itself, because if you push the person towards therapy, it becomes a little rude. So just ask the person that what do we do about it, because my capacity is only this much. And not go into that complex of being able to help everybody around you. It's very easily to go in there, that I heard this person, I'm available for this one. In fact, belonging to this medical field, or even me being there as a therapist, for the longest period of my time, I have been in that position, and it's very exhausting after a point of time. So you have to know your own limits, be aware of it. And yeah, I think being honest about those limitations is a great way. Also, do not use the information that the person has shared with you. Do not make use of that information or the labels. Do not give diagnosis. No. As a friend or as a partner, you're not supposed to provide with any diagnosis. You're not providing any labels, not using any labels. Do not use that information even to set any examples. It's hurting, right? So these are certain don'ts when you're taking care of a friend or a partner suffering with mental health. issues.
Thank you, ma'am. That was a great answer, actually. And in these times of chaos, where we are kind of we feel helplessness because we don't know what to do, and sometimes even if we do something, it might go wrong. And these do's and don'ts are much helpful for us right now, so that if anyone approaches us, and we'll take care of them in the right way. Thank you, ma'am. And over to Srilan. Next question, please.
Good evening, ma'am. Myself,
Hi.
Srila from COPH. Like, I want to ask you, what is the importance of consent, ma'am? Or should it just limit to the sexual context?
Oh no. It is important everywhere. Very, very important, in fact. So, I mean, consent technically is a word which only, we talk in terms of yes or no. That, the person said yes, so I just went by it. And what's the harm about it? The person wanted it, the person said yes. It goes beyond that. Actually, I get a lot of cases where even after having sexual engagements, the person comes back and feels, molested in a relationship. So that comes in when the consent has been pushed on the person by certain manipulations. What about that? So when the person said no for the first time, this I'm talking about any interaction. It can be a sexual interaction. It can be a non-sexual emotional interaction also. As simple as this, that, when people were talking on, when people talk on these dating apps. So let's say if a person wants to go on a call with you. So did the person ask you, or is the person forcing you to go on a call? Pushing you. And every now and then, if you're asking a question, that definitely comes in a fear in most of the people, that if I do not say a yes, I'm going to lose this interactive space. If I'm not going to say a yes, then I might lose this person altogether. So then would you want to consider it as a consent, or would you want to understand it as being under pressure and being manipulated? So that is very important to understand, firstly. Secondly, consent is important even to go on a call with your parent. Are you careful about what mental and emotional state they are in? Is it okay if I talk to you about this issue right now? It's a simple question. Or can we decide some time to go on a call because I want to talk about certain concerns? The simple ways of, asking for consent are there. It is not just about, taking a yes or no. It goes beyond that. Am I respecting the other person's comfort? Am I respecting the other person's state and boundaries? So, because if you have to come across something like you want to do something, the other person doesn't want to, let's say. So is it that the other person just doesn't want to, or the other person doesn't want it right now? So understand that's fair first. So it's all about understanding the discomfort of the person.
Now I want to ask you about like how to show a consent when you're knowing like your friend's lifestyle is deteriorating his health. Like for example, he's consuming alcohol, smoking and all. And without he's not aware about his health himself and he's doing such activities. So how should we concerned about those activities? Your views on that?
Yeah. So mostly I would say even I have been there and I have told people, don't you see you're harming yourself, So mostly you should be talking in terms of I rather than you. You're doing this wrong. You're going to harm yourself. The person is not seeing it that way. It is you who is seeing it that way, right? So the idea is that I am concerned about how this might harm you. I am concerned, I am worried. So your feeling and your worries around whatever you're seeing might cause a problem, because you're seeing the outcome as a problem. The person may not be seeing that. The person might be using those lifestyles as a coping mechanism. So first and foremost, I statements are important. Secondly, that stop participating to draw those boundaries. That, if you see a problem in certain behavior, let's say if a friend is smoking too much, so then just say that I am not comfortable to see you smoking because I feel worried. So I would want to probably not be around you while you're doing it. I can't stop you because it's a choice of yours. So I will rather, for that moment, not just stand by your side, because that probably gives me the discomfort of not telling you things as a friend. So again and again about, being honest with your emotions, with your state, and how you are finding it uncomfortable, rather than pushing that discomfort onto the person. Firstly, and then next is that, you can talk in terms of the outcomes, whether the outcomes of the behavior that the person is practicing, in daily life, is it helping the person? Because if it is helping, then definitely the person will keep repeating it. And if it is harming the person, then just a conversation is enough to, give that sense of awareness that, if it is harming, then what makes you to repeat it? So more than, pinpointing and pushing, make it more about trying to understand where the person is coming from, or what is making the person to practice certain things. So that will open you up for a conversation rather than an argument. So
that was an amazing answer. Like, we all needed that answer, ma'am. Thank you so much. Like, next question, what does gaslighting look like, and how do we identify someone is gaslighting?
Gaslighting, it is bad to undergo that. So gaslighting is, a manipulation. It's a form of manipulation where there is pathological lying involved. So how does it appear as? You're very sensitive. You just overreact all the time. Or when did that happen? I don't even remember it. So, those sorts of reactions. I think you should see a psychologist. You're just going crazy. So instantly dismissing, denying, inducing you with a lot of doubt, so that you start feeling the guilt, the threat, the anxiety, and the confusion about your own emotions, perceptions, and memories. So all of these things, which, from where you talk about an event that happened and how it made you to feel, it's rejected outrightly in different ways. So that's gaslighting. Technically defined, it is that way. The different aspects that come under it, the different red flags that indicate that this is a gaslighting behavior. So it is, like I said, it is denying. So whenever you talk to a person and you're telling that person that, this event happened and it was not good, I did not feel okay about it, you shouldn't have done that. When did I do it? I don't remember it. So the event has been denied. Okay. Then dismissing is, let's say, why I feel hurt when you do this, or you always feel hurt. So the emotion has been minimized and dismissed. Okay. Then let's say it is, I have written down the points though. There are too many to define gaslighting. It's a long thing. So, but then it is also like turning around the tables, if you're talking about somebody who's hurt you, instantly the blame comes onto you, because every time you behave like this, so I feel angry. So when you're talking about what has caused pain to you, instantly your behavior has been blamed, your reactions have been blamed, and the table has been turned around onto you, and you're being made to feel guilty about having spoken about an issue altogether. So these are the different red flags and ways in which, gaslighting works.
Thank you so much, ma'am. Now we can identify like someone is gaslighting or not. Now I'm handing over my session to Victor, so he'll be taking over the questions from here. Thank you.
Thank you.
Okay, it's me, Victor, again. So let's go on to the next round of questions, ma'am.
Yes.
So first thing is, as a therapist, what does paranoia look like in times of a global pandemic or even otherwise? And how do we start tackling paranoid thoughts when they start arising?
Firstly, I would like to replace this word paranoia here, because paranoia is more like, a technical word which we use in terms of somebody feeling delusional about being, being chased or looked out for, to
Insecure,
be
yes.
harmed. Yes, to be harmed specifically. Okay, so we use paranoia there. So the term that we use is catastrophizing. So catastrophizing is when there are uncertainties, and with little information about anything, you happen to give an extreme negative conclusion to a situation. Example that if I step out and if I do not pick the call, and somebody back at home starts feeling, oh, what, has she met an accident that she's not taking my call? So just one call that I did not pick up, the immediate catastrophization went on to an accident or my death or anything of that sort.
Yes,
So that is an extreme negative possibility. Conclusion. So catastrophization, yes, a lot of it came to the forefront because, again, as a matter of fact, it was real that we were facing, loss in terms of lives, and going through a lot of trouble in terms of health. And because it was something we did not know of, the virus brought in a lot of chaos. So uncertainties and uncontrollability has been there. So that gave people, especially who have, anxiety reactions in general, as a tendency. So, their mind went at all places. This will happen to me. What if it happens to me? What if I lose a loved one? What if, I die? What's the purpose of living through it? When will this end? Is my life just stuck here? So these were the different forms of catastrophization that came in. I'm never going to, like life is not changing maybe after this. And when you think with so much of, assertive conclusion, which is negative in nature, your mind doesn't give you any space for any other possibilities to be thought about, to think about. Is it, as in, what if I fall ill? Then there's also a possibility, what if you do not fall ill? You're not talking in terms of that. You're actually saying, I will fall ill, I will die, I will end my life, and I will not reach anywhere. So whenever the conclusion is given already, then it is catastrophization, and that is what leads to a lot of anxiety.
Okay. And so if we're having paranoid thoughts, are there some basic steps that we could take?
To deal with such catastrophizing thoughts, first and foremost,
Yes,
I try identifying, the what if, the worries, the specific worries that you're dealing with. Example, I'm worried that if I fall ill, I may not find help. So worries in terms of possibilities that you're thinking, even if it is negative, just list it down, try listing it down. And then try, figuring out for facts. Example, when we're thinking too much about deaths, you're forgetting that the actual number of recovery is way more than the number of deaths that have happened. Okay, so am I taking care of the facts? Being scared of the number of deaths is okay, but concluding that, this is all it is, that is where the problem arises from. So think in terms of worries, list those worries, think in terms of possibilities, and try thinking of 2 to 3 possibilities of a situation rather than just taking your mind to one negative possibility. And then try identifying the already existing chance factors. Whether the pandemic was there or not, weren't these chance factors anyway there always? Even though, yes, again, like I said, the crisis that came in, that crisis was difficult, has been difficult, and might be difficult further to deal with. So then in that crisis, learn to address, that separately as compared to the conclusions that you probably have a tendency of giving otherwise also. So major work of, self-reflection in terms of thoughts.
Okay, ma'am. Thanks for that. And the next question is, ma'am, what is the role of social media in causing anxiety or healing anxiety?
Yeah, so social media, in terms of what would you want me to address first? Causing anxiety or healing it?
Causing anxiety, ma'am. How is it responsible for augmenting the anxiety reactions in us? We'll go to that first.
Yes, so there was this term, majorly used in terms of social media and came up during this lockdown majorly, doom scrolling. You're just sitting with your phone or your social media profiles and you're just not even reading through or stopping at anything, but you're just scrolling through. And you're not aware what are you scrolling through, and probably even liking without realizing what are you liking, and then you suddenly stop at something, give a glance to that, and then just move on. Now, while you're doing this, your mind is retaining all of the information anyhow. Also, it is also changing the algorithms for your media profile, the internet. Okay. And as those algorithms are changing, every time you open up social media, you'll only find, triggering news around you. So there was one thing that was majorly adding to the anxiety whenever people were going on social media, especially, again, I would say in the second phase. In the first phase, people were anxious about, that the world is doing a lot of things I am not. So a lot of self-worth issues, negative self-worth issues came up. In the second phase, a lot of triggering news came up that I'm not able to help there. I'm very privileged and, a lot of things are happening and it is very triggering. So different things came up. But then, yes, as a result of doom scrolling. How the media has been helping in anxiety is, or maybe let's say mental health, is that a lot of people have started talking about it. A lot of platforms, a lot of influencers. I would say most of the psychologists and clinical psychologists have also gone on media to, promote their work a lot. The problem coming in from there again is that people who are reading through it, they do not know what is, what are the facts and what to believe and what not to believe. So as a matter of fact, I recently started getting cases wherein people are reading a lot, but they're just labeling themselves now. So they're using a lot of technical language to label themselves, and suddenly with those labels, they start feeling anxious, even though those labels may not be applicable on them.
Yes,
so even if there is help available, because it is not coming from a conversation, it's not coming in as an interactive education. So it might put in doubts. And again, the labels, the conclusions that you're giving to yourself, that again puts you in a stressful situation. So just read the information, be aware of it. Definitely being aware includes, reflecting, but do not conclude, do not self-diagnose.
Yes, ma'am. Now that's very important because a lot of people these days would mistake grief to be a major clinical depression or something and label themselves and go about talking about it. And that's becoming something that we encounter commonly. And so thanks for throwing some light on it, ma'am. The next question is, what are some effective techniques to tackle anxiety in a short term?
For short term, let's say, so for short term, definitely there are a lot of techniques we do provide our clients with, because, let's say if I'm not present, or let's say if the therapy couldn't happen, then what are the techniques they must use? So then those are known as grounding techniques, which I provide them with. Grounding techniques are basically, the whole idea is to make use of your, sensory information. Let's say, what can you see, what can you hear, what can you feel, and what can you smell. So all of these kind of sensory stimulation helps you to divert your mind from the symptoms of anxiety. So therefore, these are known as grounding techniques, you're grounding yourself with the the information that you require right now. Because in anxiety, what happens is the mind suddenly switches into an anticipatory mode where it is anticipating only danger and emergency. So it is actually activating your fight and flight system entirely when it is not required. There is no danger. The mind is only making you to believe that there is. And because of that, the body regulation, the blood circulation, the breathing process, everything changes suddenly. And the person becomes highly preoccupied with those symptoms, and the symptoms increase the anxiety in turn. So first step is to get yourself educated entirely with what exactly anxiety is, how does it function. Second step is, if possible, definitely go for therapy. Yes, I mean, there is no shortcut to it, because if it has reached that level where it is frequently occurring, it needs treatment, clearly. Okay. If you want to practice certain things for yourself, then try changing the sensory stimulation for yourself by creating, different stimulation to divert your mind in that moment. For example, quickly holding ice cubes, or quickly just putting your feet in cold water, taking a shower. These are few quick techniques that can suddenly change the stimulation for your entire body. And with that, the body, suddenly gets confused. The mind gets confused and shifts from that alert mode to a more relaxed mode. So the idea is to shift from that anticipatory, alert, emergency mode to a more relaxed mode. That's the only concept you need to learn. Deep breathing is another thing, deep breathing, just simple breathing, just diaphragmatic breathing is what you require. And then maybe just certain mindful techniques. Mindful techniques could be that walking barefoot on the floor, or maybe on grass if it is available, like being around plants, maybe feeling those plants. So these are certain mindful techniques that we suggest for.
Okay, ma'am. That's a really good thing. I hope these examples help a lot of people, especially in such times when getting therapists is not always an accessible or feasible solution. So let's go to the next question. Could you please explain, ma'am, the difference between grief and depression?
Yes. So, I mean, do you want me to explain it? There are two ways to go about it, to understand it. Depression is a part of grieving. If we talk about grief, okay? And then maybe I'll separately talk about depression a bit. So grief has several stages to it, and grief is about any loss. It could be, loss in terms of losing somebody's life. It could be loss in terms of losing your finances. It could be loss in terms of losing your lifestyle, anything. So grief comes in with any kind of major loss that has, brought in a major change in your life. Now, the stages for it is, you first tend to deny it, that, it cannot happen to me. It has not happened. It's just me thinking that way or feeling that way, maybe. Or maybe there's something I can still do. Maybe there's still any chance. So you're looking for chances and not wanting to believe that it has actually happened. So that is the first stage, and we call it denial. And then the second stage is that of bargaining. Anger, sorry. The second stage is of anger, that how could it happen to me? Like, why did it happen to me at all? Why did I not get what the other people are getting? Why can't I be in their place? And nobody knows, nobody understands. So that kind of anger, comes in. And then bargaining is like, okay, fine, I just wish this happens for me, and maybe, like I'll replace it with this, I'll make another thing happen in place of this. I just want this. Just get me this for once, and I'll replace it with something else. So you're bargaining the the loss that has happened. Okay. And then comes in depression. That finally, you've reached that place where there's nothing you can do, and the only thing you're left with is the loss. So coming into terms with that brings in depression, which is, suddenly you're feeling helpless, you're feeling hopeless, that nothing can happen. There's nothing in the world that can change this current situation that I have now, because you've tried everything at an emotional and mental level. So that's where depression comes in. You would not want to do anything, you would not want to live, maybe, those kind of things. And then comes in acceptance, the last stage, that okay, fine, this has happened, now what do I need to do about it? I can't continue living this way, maybe. So these are the stages of grieving, and people go to and fro in these stages. It's not fixed. The manifestation, there is no fixed form of manifestation. There is no fixed way of it, and people have different ways of coping with it, different ways of expressing it. So that's how grieving takes place. When you talk about depression is, you can say, extreme sadness, where you are probably dealing with, when we talk about it, it is mostly in terms of feeling hopeless, helpless, worthlessness, not seeing anything in future for yourself, feeling very, very bad about your current situation and about your past, and then also not feeling, as in you don't find anything worthy enough to live for. So it's not like you want to die for sure, but because you're not finding any purpose to live for, so you want to die. So that's how depression manifests itself. There's a lot of fatigue, a loss of interest in, most of the activities that otherwise used to help you or interest you. So all of those are the signs and symptoms for depression.
Okay, ma'am, thank you. To those who are viewing this, I hope you're actually noting down these points, as you could always refer to them, these suggestions, and have a better idea. So if you're not doing so, this is a gentle reminder for you to do so, to make the best out of the session. Now on to the next question, madam. What exactly is a post-traumatic stress disorder? And how can it not be misinterpreted?
So post-traumatic stress disorder is something which we diagnose when, person has suffered with trauma very directly in the sense that either it has happened to me, or I have witnessed it to physically happening it to somebody else, or I am related to certain work. Let's say I am a person who is into groundwork, and I happen to get a lot of information about let's say abuse every day, or let's say deaths every day. So I'm reading those cases directly. Okay, and it's a very direct information that I'm getting to know of. Or let's say if I have grown up in a family where a lot of, or let's say I have heard of cases who have suffered with trauma. But then all of it should be a very direct interaction, not like, I read a case on social media and that was it. So I felt traumatized. I felt triggered is the word there. When you feel traumatized, it has to be long enduring trauma that you have gone through directly or have witnessed it, very physically being there. So that's the major, let's say, pinning that we need to do while diagnosing it. Then there are memories and flashbacks frequently occurring, whenever you're sitting to yourself, there are major flashbacks, and those flashbacks are so real that the person starts reacting in the same way that the person might have reacted in the traumatic experience. So for the person, the trauma is like reoccurring altogether. So again, the mind and the body goes in that state of reaction, and mostly it dissociates. Dissociation is like, it's a defense mechanism that your mind makes use of, the brain makes use of to handle stress. So basically, you might faint, you might start behaving very regressively, or you might just start yelling and reacting and whatever. It can differ. Again, the manifestation can differ, but then there are reports of flashbacks of the memories. Then nightmares are reported very frequently of related to the trauma, or maybe, you know, in a different form, but then related to trauma again. And the person is mostly anxious or depressed. There is a lot of self-blaming that happens, that maybe it was my fault, it happened because of me, I could have done something to, you know, avoid it maybe. So all of that, anger reactions being there because again, you felt out of control, or revisiting the, you know, there are certain patients who would deliberately revisit those memories because in that trauma situation, they have felt so much out of control that now in their memories, they want to take control by revisiting in there. So again, it has various manifestations and aspects to it, but the major signs and symptoms are that of, you know, experience of trauma being there and flashbacks being there.
Okay, ma'am.
Anxiety, depression coming
So
in.
that was, that was really what we were looking for, I believe. So the next question is how to handle toxic family dynamics when one can't move out from the house or live independently. If that's not a solution, then how do we handle toxic family dynamics?
Using this word toxic is again a very, you know, it's an umbrella term as such. You know, are we talking about physically toxic or emotionally toxic or both? You know, because in both the cases, you have to take care of different things. Like, for example, if it is, and then also sexual abuse. I mean, I am sorry I'm talking about it on this platform, but then sexual abuse is very real in families. Only recently we got a case where the child was abused by the father. So, and it was a sexual abuse, harassment for ages, and the child has been dissociating. So, you know, so in what terms are we talking of abuse really, or toxicity really? If and then the care to be taken will depend accordingly. So let's say first step is, what are your safety and support measures? You know, do you have certain emergency numbers around you? Do you have certain safety boxes around you? Like I had a client whose phone was taken away by her parents, and one of the parents was very aggressive. So because she is an adult, even though she's financially dependent on her parents, but then because she was an adult, so it was recommended that, you know, to somehow get a phone and keep it for the sake of safety. You know, if tomorrow there's something, you need to contact somebody, you need to have a phone. You know, so even if it is a small phone, then that has to be kept. And then what are the other safety measures? So again, like I said, safe emergency numbers in terms of not just the social, you know, the services that we have, like not just the police services that we have or the numbers of the advocates that we have, not just that, not just the helpline numbers available, but also in terms of who is my closest friend who can have the, you know, like can be the support for me, who is the closest relative who can be a support to me. So having their numbers in place as well. It is important that beyond your family, one person must know about it who can be supportive of the conditions. I usually tell my adult clients to be aware of their legal rights. You know, just the awareness of it gives you a lot of strength. So I tell them to be aware of their legal rights. If you talk about basic, you know, dynamics, unhealthy dynamics in a family where you just want to have your boundaries in place and, you know, not get engaged into unhealthy conversations or, you know, all of that, in those cases, boundaries are important. First and foremost, I think boundaries of different types are important. You know, if it is a place where you feel that it is better to withdraw myself than getting engaged with my family, then do that if you feel safe that way. If you feel that you can afford some amount of time or maybe one day in a week with the family, and decide for certain areas for conversation, that these are the areas where the family or me, I get triggered. So maybe I will not talk about these areas. We will discuss about general certain, like very generic movies or songs or just random stuff. So that's another way to have those boundaries in place. And let's say the other person is talking about it and you're not able to withdraw. So in that case, just do not engage too much. Just listen. Listen to what the person is saying rather than engaging into it. See it as the opinion of the person, the perception of the person, and not something as the person is, wanting you to buy. I mean, even though that is the case, but you have a choice not to do it. So remember that the choice lies with you as well, to whatever extent. Try focusing on that. Try focusing on what controllability lies with you rather than focusing on what is the uncontrollability that lies with you. And then build around, the dynamics of that. So that's what I can tell you in such a small span of time. And then this differs from, specific dynamics.
Family to family, yes.
Yes.
Okay, ma'am. Thank you so much. And the next question is, could you please talk something about body dysmorphism and eating disorders maybe, and how they're connected, and how they're perhaps if they're too severe that we will definitely need professional help to tackle these issues, then people need to be aware of that fact as well. And I'm sure you could make them aware of it.
Yeah. So I would say that most of the topics that we have covered today, they are the topics that definitely at one point or another time, they do need professional consultation. Nothing else than maybe just 2 sessions or 3 sessions to understand what is going on. And then later on, whenever the person feels that, okay, now I can go in for the treatment for it, then go ahead. If currently you're in a space that you can't go in for the treatment, then at least know it from a professional person that what exactly is happening. Okay, that awareness helps a lot. The other thing is that when you talk about eating disorders, because you're using the word disorders here, it means it needs treatment anyway. It's a clinical issue, right? So it needs treatment. The types of eating disorders are, the 2 major types that, again, commonly people talk about and know about is anorexia nervosa and bulimia
nervosa.
Yes. So anorexia is, the manifestation of it is, the signs and symptoms of it is that the person suffering with anorexia has this belief that the person is overweight, even though clinically the person is underweight. So, and when you treat people with anorexia, it is not just the eating disorder that you have to treat them for. Then you have to, take care of the weight issues. You have to make them eat when they're not able to. And because they've not eaten for this long in their lives, so it becomes difficult. The hemoglobin falls down, the blood sugar levels are difficult. They have mostly damaged their organs sometimes. So it needs hospitalization, so to say, and not just, any treatment. So it's a really serious problem that way. So, but then because the person feels that, the person is just wanting to lose weight because the person wants to look better and the person is already underweight. So the belief of that, weight system is delusional, very much delusional. And then when you talk about bulimia, there the person has episodes of binge eating and then purging, using laxatives and forcing them to vomit. And yes. So again, that is very damaging. So both of these though come from the idea of body image issues only and compulsions. There are signs. So when you work with such clients, I mean, even though I have personally not, I did get one case, but then because, they have a very strong belief system and a lot of anxiety. So ideally they need admission. So it's difficult to handle them in a private setup or, therapy sessions where no base work has been done. So there is a lot of lack of, compliance to treatment in such cases, because it's a deeper work that you need to do with them. So compliance comes in as a major issue with them. Then there is, anxiety eating that a lot of people do, that, I was just feeling low in mood and so I wanted to eat. That works mostly like any other addiction, I would say. Like when you're stressed and you would just want to smoke or you would want to drink. So it's giving you a high in that moment. So does food gives us. The junk food has ingredients in it that gives you that high in that moment. It stimulates your mind in that moment. And then, but then later on, is it helping me or harming me? And then most of these cases come in from the background and the history of body shaming, worthlessness issues, self-doubts, and body image doubts. So even body dysmorphia is like that. The person starts believing, the person has a very strong belief, almost to a delusional level, that this organ or maybe, the whole body that I have it's just not good. I don't look good. I look monstrous. I don't like this part of my body. I want to get it changed. And then they start searching a lot about plastic surgeries and how they can get it done. When can they get it done? So, and then still not being satisfied. So that's how the manifestation of these, issues come up. But you'll find them more often in hospitals than in private setups.
Okay, ma'am. So after this, we're going to the next question. What are some practical ways that we can adapt to destigmatize mental health amongst the older generation, which isn't that inclusive and understanding in most cases?
Yeah, so I guess in this concern, what I'd like to say here is that it's important to develop a platform where we are into, like open discussions with people. So when we sit down to talk with people, our concern is to, successfully sell them immediately what we want to. Like if I'm talking to you right now about something where we share different opinions, then I would want you to immediately reach a point where you're, somewhere showing that you're agreeing to my opinion. Mostly our conversations go that way. Again, there's a major change that we need to bring in when we're talking about certain issues which already do not exist in their conditioning and in their system. So let's say if, the older generation doesn't really talk about emotions, then first talk about that. Like, maybe know their experience about, let's say, can you share an event where you felt too distressed? Or can you share an event where can you share a story where maybe you felt very anxious, and explain them what that means? Scared. Definitely they'll be having those stories to tell you, and then ask them only that, so how did you cope with it? How did you manage yourself in that period? It must have been hard. So understanding their perspective first is very important to bring about any change in the attitude. Okay, so and then maybe try asking them that how do they look at these the concept of going for treatment for these things. Is it important or not? And if they think that it is not important, then what makes them to think that way? And then providing them with little stories or little facts of where these things are important. So again, more like a conversation than like an argument or a debate helps better in such instances.
Sure, ma'am. Thank you for that. So that definitely makes us understand that we need to show some patience when we're talking with older people, make them inclusive, and then slowly take it up to them. So that's something that people have to highlight today. Now, moving on to the next question. How to educate the underprivileged strata of the community about mental health?
Yes, so to this question, actually, I'd like to add one thing here, that when we talk about the underprivileged strata, we also need to understand that their needs are very different from ours. Okay, so firstly, understanding what are their needs is very important. You know, in terms of, let's say, their daily needs, if they're dealing with that, then you can't be talking about. So in those let's say, struggle with those daily needs, how do they feel? So you have to first start connecting with the other person or group of people from where they come, not from the point of view that you have. Like, what are their struggles? How do they feel with those struggles? How much do they conversate with each other about those struggles in terms of their emotions? Because if that is not happening, then you can't be talking about mental health to them. You can't be spreading awareness about mental health to them. Because for them, trust me, I have been in a government hospital, and then there, if they come, they will just tell you that we don't have time, just give me that pill that you gave me the last time, the red colored pill helped me a lot, so give me that pill. They don't have time to talk about these concerns, because for them the time is more for labor and more for daily needs than ours. So definitely mental health is a privileged idea, I wouldn't deny that. So if you want to reach that strata, you first need to develop the concept of what their needs are, what are their struggles in terms of emotions, do they talk about it or not, and then probably in ways of telling stories, that how is it important and why is it important, how does it give a different perspective. So probably talking about positive mental health rather than talking about mental health difficulties, because they might need positivity, not the toxic positivity that has come in, no, not that, but the approach towards how they're seeing things can be different.
Yes,
So yeah, a lot of ground level
So-
work is required there.
Okay, ma'am. So just a little idea to correlate with it with our own medical curriculum. Is what you said somehow related to the hierarchy of needs proposed by Abraham Maslow? So it's
Yes,
like their needs stem from a bit of lower strata where we are always focused on the apex part of the pyramid. So
yes,
would we be right to say that, ma'am?
yes, definitely.
Okay, ma'am. So that clears it. So we are moving on to the last part of our session, and we'll wind up with this, ma'am. So the last thing is we'd like some takeaway messages and tips from you to remember to help us cope with stress, with life's pressure in a rather wholesome way. That could include specific problems like if a person having anger management issues, if a person is having a sudden bout of anger coming up, what to do in that immediate situation, or if I'm having a panic anxiety attack, what can I immediately do? Okay, that was something we had covered about bringing in sensations. In case of anger management, or if we suddenly hear that a loved one is lost and people are grieving for it, how to approach these grieving people, how to address them, some general tips about these situations, ma'am.
Okay. um Again, I would like to answer it in different portions, maybe.
Definitely, ma'am.
First one being, I would rather address the questions first. Takeaway, you tell me, what did you take away from my session? So takeaway, you tell me. So I'll first go on to the the anger and all of that, the tips to handle that maybe. So when you're
Sure.
feeling angry, anger is again a manifested emotion, mostly emerging from the feelings of pain, hurt, suppressed emotions, a lot of guilt. So when we work with clients with anger, we try understand, where is it coming in from? And then are those reactions, let's say, have those reactions turned into aggressive reactions, like I want to throw stuff, I want to hit somebody, I want to use abusive language. Then what leads you there suddenly? What is the trigger? Most of the times the trigger found is the meaning that they give to the event in that moment. Let's say this person said this thing to me, so I reacted. Now, when this person said something to you, what meaning did you imply to it? What inference or conclusion did you give to it in that moment? Like, why am I being, they just blame me always. I know I'm the bad one in the family. So the moment these are the triggered, conclusions that you have given to whatever is being said, because it's probably being done to you repeatedly, that leads to the anger reaction. So in that moment, what meaning did I understand what the person meant, or did I give it to my own meaning and felt angry? Did I suddenly feel the loss in my power in that moment and helpless in that moment, that I started reacting in anger? To gain that power in that moment again. Because when I'm angry, the other person will either go silent or start feeling guilty. Or what is my anger providing me? If it is providing me power over others, or there are secondary gains coming in with that anger, then I am going to, because it's giving me benefits, so I'll keep practicing it. Why will I stop? Right. So
Yes,
then
ma'am.
that is, see, most of the times, when cases with anger come in, it is not the person who would mostly come in, it is mostly others reporting it, and then the person comes in, or others get the person that this person has a lot of anger issues, So that's how the cases come in. So when it is about anger, again, grounding techniques work with that. Breathing, grounding techniques, mindfulness techniques, identifying your triggers. Sit with yourself for 10 minutes, reflect what causes anger issues with you. Like, what makes you very, very angry? What leads to that anger? What meaning do you give to that situation, or the triggers that you generally have? Reflective work helps a lot. So that is one way to go about it. And then, like I said, grounding techniques is important.
Sure, ma'am.
Having
I
water.
believe this would help a lot of us, definitely. So from this, let's move on to approaching people who are grieving. Because we find a lot of people in our own family like that among our circles these days, increasingly, who are facing a loss that we may not always share in the same extent. Yet we may stand the responsibility of going and helping them out. So in that kind of a position, what's the best way to approach a grieving person?
Yes, for grieving again, let's say if you are wanting to be a support here, okay? So in that case, a good idea is to have a specified time period where you're spending that time with that person. Also, does the person need your support? Has the person asked for it? Because most of the times it happens that the person who is grieving may not want too much of intrusion from the other end. So again, being available and pushing yourself to support the person is different. That the person must be aware that I have these people whom I can call, or like randomly just asking that person once a day that, hi, how are you feeling? That's it. Hi, I hope you're eating well. So just very general check-ins, but not really pushing the person to talk about the process of grief unless that person from the other side wants to. Because who knows that the person has again just started to feel a little better and you've pushed that person in that phase again. You don't
Yes, ma'am.
know, right? And then letting the person know that I'm available. Sometimes it's okay to define your time of availability also, that I have my meetings from this hour to this hour, You can connect with me if you want to. I am available for you from this hour to this hour, if in case you need me. So, a lot of framing and usage of words or tone is what helps you to, be supportive of others. So, I mean, yeah, so that's what should be done. The other thing is, we mostly talk about, when we talk about loss and grief, we mostly focus about the negatives. You can talk about the happy memories. You can talk about the experiences and the stories of how the person, let's say if it is a friend's parent or a friend's grandparent whom you also knew closely, then talk about how you're missing that person as well, or how, you do remember certain connections that you had with that person, or so these memories and sharing those memories is important. Also, practicing certain rituals that the person whom you've lost used to like. We suddenly stop everything that I don't want to. It's always a great idea to kind of do those things. Let's say I had a person who shared that her grandfather used to like it when she used to bake. And when she was baking, it was, she was missing her grandfather suddenly. So then we talked about it in the session, and I recommended her that how about, dedicating it to your grandfather altogether and then having that cake.
Like it's a constant way of memorializing the person.
Yes.
So that we actually feel they're remembered.
Yes, exactly.
Yes.
So a lot of fear that is attached to grieving is that if I move on, I'll be forgetting the person. That's a major fear that a lot of people deal with, that moving on means forgetting the person. Moving on means not talking about the person. No, it doesn't mean that. It means that accepting the person's absence and still growing around it, maybe, like living with that.
Yes, ma'am. So I'm sure that will be extremely valuable to those who are facing ourselves such situations. Lastly, I would like to wind up with a few things that people watching our live session have put up, a few tips that they would like to get from you. And with that, in a few more minutes, we'll wind up the session, ma'am. So how to feel motivated after coming out of a wedlock is a question from one of our viewers. Would you like to say something in brief about this, ma'am?
How to feel motivated after coming out of a wedlock?
Yes, ma'am, exactly, a wedlock.
Okay. First and foremost, whenever you're wanting to, kind of cope or move, do understand that, or feel motivated, because when you're wanting to feel motivated, you're also kind of, the underlying idea is to move on, right? So in those terms, it is important to understand moving on is a to and fro process. There would be days you'll feel motivated. There might be days you may not feel the motivation for anything at all. Give yourself that time. I mean, because if it has happened recently, it might take some time. Even if it has happened, few months back or a year back, there could still be days coming in where you'll suddenly go back into those flashbacks and memories, and it might become difficult. Again, try reminding yourself the reason of, like how to attach yourself with yourself is the whole point here. Validating your own emotions, validating what you're doing and what you've done this far. When the person was not there around you, what were the things that you used to do initially, or what were the things you used to miss while you were in that wedlock? Start to pick up those things and interests, because with every responsibility, there's certain, part of our lives we also miss. Like there's a difference in not being married and being married. So if there was that difference, then would you want to pick up certain things to practice from what you used to miss while you were in that relationship? So those are little things, and take very little steps, like very little changes, because there's a big major change that has happened, which is anyhow again stigmatized for some, uncomfortable for some, unwanted for most, something we don't, like, of course we're not ready for it. We don't think about marriage in that way. So in those terms, after it has happened, just go slow, because it is a major change at several levels. So go slow with very little changes to bring in. So feel the motivation or the energy must be spent only on those little things first. So yeah, and again, more specifically, the answer is, like case to case, it can differ, because the loss of motivation, where is it coming from? Why is it happening? That way. Your mic is off. Your mic is off.
Oh, okay, sorry about that, ma'am. Okay, along with this, we are coming to a question from Srishti Sinha. Dear ma'am, how to overcome health anxiety? I think we have already addressed that in our session. How not to relate ourselves with the situations? That's now a question from the same person. Would you like to say something about this, ma'am?
How not to relate yourself with situations of what sort?
Yes, ma'am.
In any situation, you mean?
Yeah, but let's take it to be negative situations in general, ma'am.
Yeah, what I'm understanding from this question is, like, again, a lot of people ask me, and in general, they have these questions that, we get affected very easily with everything that is going around us. I'm not sure if the person is wanting to ask a similar thing here, but mostly, like, if I'm too much of an empathetic or a sympathetic person, then I get very easily affected from the world around me. In that case, take pause breaks. You need to pause and step back from everything that is stimulating you a lot emotionally. So engaging is important, attaching is important, feeling is important, because that's your strength. If you're able to feel something, that the other person is feeling, that is your strength. But this strength may turn out to be, unhealthy if you're doing it too much. So
Yes, ma'am.
stop and do it. So let's say take breaks in between. Let's say decide a day that, okay, on this day, I will probably connect myself to the news updates, or maybe I'll connect myself to, my friends and relatives to understand what's going on in their world. And on other days, I will just be to myself, so that I get that break also. And then always remember that there's a difference in supporting and taking up the responsibility for others. That the latter thing you can't do. You cannot take the responsibility for others. That is their concern. You can be supportive when a person is wanting your support. Like the person, many times the person will only tell you that I need your help in this concern. So then help it, be a help there. Do not push yourself to be, helpful.
Precisely. Yes, ma'am. That's really insightful. Thank you so much. I feel really happy to hear that. And it's also put by you in a very concise manner that's easy for people to pick up. And that's something that's very special about our session today. Now, let's take the last question of today. It's from Prakhar Verma. How to deal with workplace toxicity? For instance, managers are very unpredictable. They support and praise your work, but at the same time, they have the tendency to throw you under the bus, and leaving workplace cannot always be an option. So workplace toxicity is the main talk for this question.
So whenever, in whichever situation we talk about toxicity, there is a lot of dependency factors that we need to be careful about. Let's say if you're talking about toxicity in families, in partner relationships, in friendships, or even if it is about an office setup. Am I becoming a codependent person? Is my worth, or the analysis of my worth, dependent on how this office functions? Am I able to see myself beyond this office place or not? Because if that is so, then the issues lie around the self-worth, because then I'm forgetting the choice that always lies with me. I may not be able to, let's say I am in a situation which is being seen as, perceived as that I cannot leave this place. So again, is it a fact that you cannot leave this place for certain factors, maybe the financial concerns, maybe the job possibilities in your profile, or maybe the difficulties that you're facing? Or is it a perceived idea that I cannot leave this place? There's a difference in the two. So if it is a perceived idea, then where is it emerging from? Is it emerging from my codependence, my self-worth issues, my doubt on this, concept that I cannot apply in for further jobs, maybe. I will not get enough salary. Then again, is toxicity more, more of something that you can handle for a longer term, or you can do with, a little lesser pay? So what is your priority? And then accordingly, if you have to stay there, what are the minimum boundaries that you can set? Can you say a no to the, colleagues or the boss around you? If you can't, if you're being shamed for that, then is there any other way to go about it? Is there any harassment cell maybe in the office? I don't know. I do not know how far that can be taken, ahead. But then still, if it is a possibility, if I can talk to my boss that these are my concerns and I'm facing these issues, I am facing these issues, I am dealing with these issues, what do we do about it? So if the, sometimes if the boss is such who needs power over you, so then a perceived power can also be given to the boss while you're wanting to sort your own issues. So focus on the goal should be that my issues have to be sorted this way or that way. But if I am just in that loop of, addressing the problem rather than trying to find out the solutions for it, that means I am in a codependent space. I am caught in that victim loop, maybe.
Yes, ma'am. I think that's very much relatable to a lot of people these days who are facing increasing pressure on their own minds due to work toxicity. That's becoming a very relevant talk these days. And I'm sure we have tried to address some of these issues that people are facing through this session. So I would like to wind up this extremely wonderful session right here. So thank you, ma'am, so much. I think we were tormenting you without even giving a little 2-minute break for you to have water or something. You've been speaking for so long without a break.
No, it's okay. I get a glass of water with me. So.
Sure, that's very generous, ma'am. And thank you so much for being with us and answering all our queries in such an accurate and precise manner. That's undoubtedly helpful for a lot of us. So we look forward to meeting you more, and I hope Simsa will always be indebted to your service and look for more service from you. That will help a lot of people. And we are all really proud of the session today that has reached a lot of people, which has actually been made possible because of your compliance, your skill, and your patience and your willingness to help us, ma'am. So thank you for being with us.
Thank you.
So that's it, people. Let's all say goodbye to ma'am for now. And I hope ma'am's words will always remain with us and help us solve a lot of crises in upcoming days. So thank you.
Thank you.
And have a great evening.
That, the session was actually helpful because there were too wide topics and too many questions. So I'm just hoping if there are anything that anybody would want to ask me, you can actually connect with me on my Instagram handle, maybe ida_clinic. And I'll be more than happy to answer your queries if there are any. So that's that. Okay.
Thank you so much, ma'am. Thank you so much. ida_clinic. I'm sure we'll remember that and note it down. So please note it down if you haven't heard it. ida_clinic. You can always contact madam through her Instagram handle. So thank you, ma'am, again. So,
okay.